I'm Dr. Arti Behl, consultant psychiatrist at Apollo BGS Hospital, Mysore. I thought I'll talk about OCD or Obsessive Compulsive Disorder today. OCD is a kind of an anxiety disorder. It's a mental health related disorder in which people get abnormal kind of thoughts which are recurrent, intrusive. They're very anxiety provoking kind of thoughts. And they are the patient's own thoughts, but they cause a lot of distress in them because they cannot be controlled by the patient. They could be thoughts, they could be impulses or images. Thoughts would be something like, they would have cleaned their hands, but they still keep getting the thought that, I haven't cleaned it enough. They want to keep on washing it again and again. Or they would get a thought that, have I locked the lock properly or not? So they would go and check back again. And that repetitive action goes on again and again for a couple of times till the patient feels satisfied. And that repeated checking or washing is termed as compulsion, and hence the name of the disorder being obsessive compulsive disorder. In this, they even get some kind of odd thoughts, as if some harm is happening to a family member. So they keep getting images or thoughts of an accident occurring or some harm happening to a son or a husband or a wife or whatever. And then what they do is they keep saying sorry inside their mind, or they pray to God. These are mental compulsions that these patients do. Now, this disorder occurs in about 2 to 3% of the normal population. It can affect men, women, even children. In fact, many OCDs, they begin in childhood, but these children, they don't know how to express themselves. Hence, they come up to us when they are entering their adolescence or in adulthood. Sometimes these patients even go into depression because of the kind of thoughts that they face, and they cannot share it with everybody. Example, when they pray to God, they get, some kind of odd thoughts like, abusing God and things like that, which they feel very guilty about. This disorder occurs because of some kind of serotonin deficiency. It's a neurochemical in the brain. And the treatment required for it would be with the help of medicines and therapy. Therapy in layman's term is known as counseling, but it requires special techniques to, perform this kind of therapy. These patients can be helped out with this kind of therapy and medications. I suggest that, if anyone is suffering with this kind of a problem, I think instead of holding it inside themselves, come out with it, seek help, or talk to someone whom you feel comfortable with. I don't think you should shy away from seeking help. For any disorder, whether it's physical or mental disorder, I think all of us should come out, seek help, and let us not shy away from seeking help, because only help can make you recover from this problem. Thank you.